All right, with more on the expertise on this heartbreaking topic, let's bring in a professional, Dr. Christine Crawford. She's a psychiatrist from Boston Medical Center. Dr. Crawford, it's a pleasure to have you. It's sad that it's such an upsetting topic that we have to welcome you, but we're stunned once again, right? Suicide of yet another promising young black person. I mean, just 2 weeks apart. This time, Cheslie Kryst literally had it all from what it looked like right from the outside. Former Miss USA, celebrity status, a lawyer who was an advocate for mental health awareness. Just talk about how things aren't always what they appear to be.
That's right. People are often left scratching their heads. Why is it that someone who appears to have it all may be experiencing significant bouts of depression, so much so that they feel hopeless about continuing to live their lives? When it comes to depression, when it comes to having thoughts about suicide, a lot of it has to do with the internal experiences, the emotional experiences that the person is having that they may not be showing outwardly. And so that's why it's so important for us all to be having this conversation about mental health and about all the different forms that it can take and what it can actually look like.
Yeah, speaking of that conversation, just talk about why it's so important for us as black people to have this open dialogue about something that is seen as taboo for a lot of us. Just seeking mental health advice is sometimes not even an option, or so we see it as that.
Absolutely. And the thing about the Black experience is that we're so accustomed to toughing it out, to
Yeah.
persevere, to being really strong for ourselves and for everyone else around us. And that can be exhausting time and time again, especially when you're living each and every day as a Black person experiencing racism and the trauma that is associated with racism. It can really weigh the Black body and the Black mind down quite heavily. And that's why it's important for us to know that there are resources such as going to the church, talking to various community leaders, talking to our families. But when it seems to be getting in the way of your ability to get up, to get out of bed, to take care of your kids, and you're noticing that the trauma, that the sadness, that the anxiety is getting in the way, that certainly signals some professional help that can come into play that can make it such that you can return back to your normal level of functioning.
Yeah, Dr. Crawford, you named clear signs there, but what about folks who don't show any signs? How do we prevent something if we don't know that they've already traveled down such a dark road?
Absolutely. And I think that's why it's important for the media to continue to highlight how suicide can impact the Black community. One way to initiate a conversation with a friend or a loved one is to check in with them and to see what this experience is like for them, hearing the news of such high profile individuals who died by suicide, and to ask them the question, my goodness, this really impacted me. I'm so shocked and surprised. What do you make of someone who dies by suicide? What are your thoughts about the issue? And that can open up the conversation to be able to experience a little bit more as to what the person is thinking day to day. What are some of the deep feelings, the dark emotions that they may be experiencing? And that could be one way to open up the conversation. It could be really hard to just jump into a conversation with someone and saying, I'm worried about you. Are you going to kill yourself? But perhaps being more curious, taking a step back, allowing for some space to allow the person to reflect on what has happened to these individuals and what that means for them.
Yeah, Dr. Crawford, what does it mean that the former Miss USA, she left this photo of herself on Instagram with the caption, "May this day bring you rest and peace." And it's a beautiful photo. What do you think that signified for her?
Now, for her and other people who experience significant, strong, intense thoughts of suicide, of ending their life, they're experiencing such deep emotional pain and they're so hopeless. They do not feel as though there's an end in sight. And it's exhausting to live each and every day experiencing the intensity of these feelings. And so, for some, viewing suicide as a way out, as a way to relieve the pain, as an opportunity to finally get some rest from all of these day-to-day struggles that they experience emotionally. That's what it can mean for some of these individuals. But so important for people to know that they do not have to continue to live in pain, that there is help available by talking to their primary care doctor, talking to a mental health provider or a counselor, so that they can get a sense that there is some hope, that they don't have to continue to live in such pain, that there are options available to achieve some form of peace. Suicide doesn't have to be the only option, but when people aren't aware of the treatment options, they don't know that.
Yeah. Dr. Crawford, a recent study by Kaiser Health found teens and young adults, the suicide deaths have increased more than 45% for Black Americans and about 40% for Asian Americans. Why are more Black people dying by suicide? Is it really just about stigma?
It's a lot of different factors that's contributing to it. For a while, suicide was often thought about as an experience that really just pertained to white individuals. But it's clear based on all of the data that we're seeing over the last few years, is that it's a problem that affects everyone, especially when it comes to Black people. And what we do know is, like you had mentioned, stigma is real. It's an incredible barrier for people to want to express the fact that they may be experiencing an emotional difficulty and may be hesitant to getting help. But it's important for us to talk to our young people about the fact that it is okay to not be okay, and to send that message and to be very strong about that message, especially during the time of the pandemic, in which there's been so much loss, so much uncertainty, and there seems to be this ongoing sense of hopelessness and not being able to be in control of our future. But we need everyone to know, especially our Black youth, that there is help out there, that the uncertainty that they're experiencing is difficult, but talking to a trusted adult is important. And then hopefully that will help make it a little bit easier for them to be willing to get help, to be able to talk to a mental health professional, and to get that much needed treatment.
Yeah, Dr. Crawford, thank you so much for joining us. We really appreciate your time. If you or someone you know is struggling with depression or just needs help, right? Needs a helping hand, the National Suicide Prevention Line. It's 24 hours, 7 days a week, free, confidential support. That number on your screen, 1-800-273-TALK. If you're in the other room, you can write it down. Here it is, 1-800-273-TALK. Those last four numbers, 8255.